Another question I got is about, can artificial disc replacement help golfers with back pain? And I would say unequivocally yes. We're seeing now the pro hockey player that want the artificial disc in his low back, did not want the fusion that the team doctors recommended. And he was smart, because he's going to have full motion and be able to play better, maintaining mobility. The same thing with golf. Golfers tend to degenerate their lower lumbar discs, the bottom two. It's the #1 injury in the PGA Tour is low back pain because of the rotational twist. Remember, your low back is not designed to twist. It's designed to flex and extend. It's only supposed to turn about 15 degrees. Well, the golf swing, you're really hyper-rotating. Ask Tiger Woods. He'll tell you he blew up his L5-S1 disc. He tore it up and had 4 or 5 microdiscectomies. He was not a candidate for an artificial disc and had to have a fusion at L5-S1. But in the beginning, he was a potential candidate for an artificial disc, but he was not pointed in that direction. I think nowadays, most people are looking for disc replacement to maintain that motion, to maintain the proper golf swing, and to help offload the discs and take some of the pressure off the facet joints. This helps you be better at golf, gets your pain down, and keeps you mobile and functional. Hope that helps you today. Thanks.